States, Kamala Harris.
Right. Hello.
So it's good to be with everyone and to be back in Wisconsin. And is this on? Is the mic open?
I think so.
Well, I can project. How about that? Okay, there we are. It is good to see everyone here, and I'm really looking forward to this conversation, mostly because of the announcements we are making today, which I will say to the head of SEIU and all of the SEIU leaders and the workers who are here. We all know what we're announcing today is long overdue.
Yes.
And we still have more work to do. But it is a milestone, and it is something we should celebrate because it is not happening without the kind of leadership that we have seen historically and currently from SEIU and all of the workers. So I thank you all. I want to thank the administrator, Chiquita Brooks-LaSure. I've been working with her during the course of our administration. She is bold. She is impatient. She knows things need to get done, and she pushes that they will get done. And so I'm so glad that you're here today with us. Secretary-Treasurer of SEIU, April Verrett, I want to thank you for your leadership always. And then I know we have Mark Pocan here. Right over there. Right over there. I want to thank you for your work in the United States Congress. I get a chance to see you all the time, and you're always fighting for the people of Wisconsin, and I thank you for that. Thank you. So today's conversation really is about the safety, the dignity, the guarantee of self-determination that comes with the work that home health care workers and care workers do. Today is about recognizing the gift that home health care workers and care workers give to us as a society. You know, it's now over a decade ago that I spent a day with an SEIU member, Wendy Coe. And I will tell those who don't or have not witnessed firsthand this work, what an extraordinary day that was. I saw an individual, Wendy Coe, who started and ended her day with the most extraordinary work that required physical strength and work, emotional work, the work that comes with caring and the amount of output then that is required to care about someone in a way that, again, is about uplifting their day and giving them dignity and giving them the respect that they rightly deserve. Home health care workers, the physical part of their work includes literally helping people get up out of bed, changing the sheets so that that person, if they are bound to a bed, can have that kind of safety and dignity that comes with caring for people. It's about helping people go to the restroom. It's about cooking for people. It's about asking the person that they're caring for, what would you like to eat today? And trying to give them something that they know they might enjoy and that they will eat and have a taste for, right? Like really caring about people to ask. It's about helping people get dressed in the clothing that makes them comfortable and doesn't irritate them. It's about saying to them, hey, it's a sunny day today, let's go outside and take a walk, or I'll take you to the park. It's the kind of care that really comes from a very special place of humanity. And the value of this work, not only to the individual they're caring for, but the value of this work to that individual's family and to us as a society cannot be understated. And so I am so grateful to our home health care workers, to our care workers, to the members of SEIU for the work you do every day. And again, I say it is about time that we start to recognize your value and pay you accordingly and give you the structural support that you deserve. So here's the situation right now. There are approximately 1.2 million Americans who are living in federally funded nursing homes. And and that's about 4 out of 5 of the nursing homes in our country. Okay, so the vast majority of nursing homes are federally funded. And the majority of federally funded nursing homes are understaffed. The estimate is 75% of those nursing homes are understaffed. And understand what that means for the resident of that nursing home. It means that there may be no one available to help them out of bed. It means there may be no one available when they fall. It means that they will receive less medical attention because the workers, the care workers in that facility are going from room to room, from resident to resident, and understaffed in terms of giving folks what they want to give in terms of the level of care. It means more loneliness. When we're talking about anyone from our seniors to people with disabilities who are in those homes and who want and enjoy the interactions that they have with these care workers. For caregivers, it means that in the midst of this noble and selfless work that they do, that they don't get paid enough for the kind of work that they need to cover. And it means that they have less ability to do what they want to do, and frankly, their life calling, which is to care for other people. And I just want to remind everybody, I know a lot of us don't like to remember the height of COVID. But our care workers were doing, and it was right at the time that we would talk about frontline workers and people would be out in their balconies banging pots to thank them. Well, we need to thank them every day.
Right.
Not just during the height of a crisis. Because the work they do is that essential. And so the 2 announcements that we are making today recognize that we owe you, those workers, so much more than applauding you. We owe you more than that structurally and in our system. So for the first time we are establishing, the first time in the history of our country, we are establishing national minimum staffing standards for federally funded nursing homes. And again, for residents, this will mean more staff, which means fewer ER visits, potentially, more independence. For families, it's going to mean peace of mind in terms of your loved one being taken care of. And for care workers, it's going to be more time with their patients, less burnout, and lower turnover. Second, our announcement is about a new requirement to help increase pay for home health care workers. And so that means a new requirement to help raise pay for home health care workers. So Medicaid currently pays $125 billion a year to home health care companies, which is hundreds of thousands of workers. However, before this change in the system, which means forever, home care companies were not required to report how their federal dollars were being spent.
Right.
Now, we are requiring that 80% of that money be spent on paying workers as opposed to administrative overhead costs. And again, I'll close by saying this. This is about dignity. And it's about the dignity that we as a society owe to those in particular who care for the least of these. This is, if you'll pardon this, but this is God's work. To care for people who often you've never met before, they're not related to you, and you care for them as though they're a member of your family. And I think everybody would want them for themselves or a member of their family. And so let's recognize the gift that these talented professionals give to families and to all of us as a society. And with that, I thank you all, and I'm now going to turn it over to April Varett.
Thank you so much, Madam Vice President. From the bottom of our hearts, the entire SEIU family thanks you, the administration, you, Administrator Brooks LaSure, for these announcements. This is going to impact the lives, not just of millions of care workers in this country, but for the millions of people that nursing home workers and home care workers care for and their families and their communities. Thank you, thank you, thank you. I just want to acknowledge the SEIU family that's in the room from right here in Wisconsin, as well as Minnesota. The 2 million members of SEIU is represented well in this room. We know we represent over 800,000 caregivers, home care workers, nursing home workers, child care workers across the country. I also must acknowledge the SEIU members who were a part of taking care of you today, the EMTs and the paramedics that's a part of today's visit here in Wisconsin. Caregivers in the room, this is your moment to shine. It is your moment to make your voice heard and to make sure every caregiver in this country knows that they are important and represented in the most important spaces in this country. So thank you all for being here. And we're going to continue to let our light shine. We're going to continue to make sure our voices are heard, especially here during Caregiver Recognition Month. The incredible work that caregivers do each and every day is a vital part of the health and the well-being of millions of people in this country. I also have to acknowledge the leadership of SEIU Wisconsin that's in the room, President Pat Reyes, Secretary Treasurer Crystal Martzell, and Executive Director Louis Davis. Care work is a lot of things, and Madam Vice President just talked about it. It's essential work. It's important work. It's meaningful work. It is 365, 24/7 kind of work. And it is emotionally, mentally, and physically taxing. A lot of folks don't understand the daily grind or the meticulous things that nursing home workers do every day for the residents and the families of people that they take care of. Things like feeding someone who can't feed themselves. Things like reading a book and spending time, just being company to someone who needs it. Things like painting nails and combing hair, giving baths, holding someone's hand as they take their final breath. Ari, Lisa and Lisa know all about this reality because they live it and they work it every single day. And they are here today to represent the thousands of care workers like all of them who far too often have work understaffed and underpaid while still fulfilling the life-saving duties that are essential to families across our country. And we're going to hear from each of you all of the wonderful things about what you do and the attention that needs to be paid and making sure that we're investing in the care industry so that you can continue to thrive in your work. Care workers across the country are united in our demand for safe staffing levels, better quality care, and employer accountability for our nation's nursing homes. Administrator Brooks LaSure, thank you for being here. You've played a huge role, and your influence is immeasurable on the work standards that we're applauding today and the outcomes that are going to be improved for caregivers and residents. So I want to turn it over to you to share a few words.
Well, thank you so much, April. And I can't say enough about how much we appreciate the role of SEIU in really bringing a voice to the work that we are announcing today. And I want to just say just a huge thank you to Vice President Harris for her leadership and the sense of justice that she brings to all of the work that we do in the administration. The sense of justice as we talk today about what we're doing for workers and what we are doing for the people who live in nursing homes. President Biden gave the Centers for Medicare and Medicaid Services, or CMS, a call to action to strengthen long-term care services and to support caregivers. We are answering that call with groundbreaking rules rooted in the President and the Vice President's vision, bolstered by your voices, your dedication, and your partnership. These new regulations were born out of feedback from thousands of clinicians, healthcare workers like yourselves, advocates, and most importantly, the people who receive nursing home care, healthcare in nursing homes or in their homes. We heard directly from nursing home and direct care workers whose compassion and dedication to helping people is truly heroic, but who often express to us the pressure to leave for service industry jobs where they could earn higher wages without the emotional and physical demands of nursing home care. At the same time, we also heard firsthand from nursing home residents who described spending half of their days in bed, waiting for help, getting up, and what an impact that had on their physical and mental health, and even, as the Vice President said, their dignity. With today's actions, we're taking immense strides towards CMS's primary goal to ensure that our programs are more than just an insurance card, but that it means access to high quality and reliable care. As the Vice President said, we are establishing for the first time a national requirement for nursing home staffing. Just to give you a sense of what it means that there'll be 2 or 3 RNs, 10 to 11 nurse aides, and 2 additional nurse staff per 100 residents to make sure that people can get the care they need. We are also advancing pay equity in Medicaid for direct care workers in home and community-based settings and requiring states to make sure that people that are served by the program have a voice at the table on how care is delivered to them through the Medicaid program. I want to thank all of you for the experiences and the feedback that you shared with us during this process, and we know we're going to hear more today. And we just want to thank you so much and know that your voices are being heard by this administration to make our program stronger, and we want to find more ways to do so. Thank you.
Thank you. Now let's hear from, we can give me, Now let's hear from workers. So welcome Lisa Briggs. Lisa, so glad you're here today. Lisa Briggs is a CNA here in Wisconsin, in Milwaukee, and a member of SEIU Wisconsin. Lisa, you've been doing this work for 12 years. Mm-hmm. You're a union steward and leader at your facility.
Yes.
I know there's a common theme here that most caregivers are family-oriented, right? We talk a lot about family. Your grandmother was the first person who you cared for, and she grounded you in your philosophy.
Yes.
To care for your residents the way you treat your own family.
Yes.
So you want to tell us more about your story?
Well, I've been a CNA worker for 28 years. I started I started with my grandmother because I didn't believe in sending grandparents to nursing homes. So I was like, since I got this certificate, I can take care of my grandmother. So I took care of her 7 years. And when she passed away, I ended up going back getting recertified, and I ended up at a facility for 12 years. I have been there through the pandemic. I have been there through the storms. I have been there when short staff was only like 2 people on the floor. I have seen residents cry and be sad because they don't have certain people they want to take care of them at the time. I have witnessed one lady, like, she's so sweet, and she always be like wants you to be there for her. And she have different people that she really care about, and I'm one. And so she make beads for the people that she really care about, and these are the ones I'm wearing now. So she always say, I want Lisa, I want Lisa. But when you short staff, you can't give them that all the time. You know, I have one resident that I took care of her for years, like 8 years, and she always liked it to walk. So when we short staff, we couldn't walk her, so she'd get mad, and then she'd be real frustrated. So I'll be like, I'm going to do it tomorrow, I promise. And, sometime it happens, sometime it don't. She passed away, and her daughter, Lisa, was so crazy about a few of us at the place. She invited us to the funeral. And she congratulated us, thanked us for being there for her mom and took care of her good. So that's why, to me, it's so important that we get more staff in facilities all over the country. We need more stronger CNA workers in the facility to give these people the same respect we would give our mother and father. So I'm really, really happy to know that we sitting at this table now trying to get this done. And I really appreciate Biden and you, Ms. Harris, for coming together, getting us together to talk to you about the importance of being a nursing home worker. Short staff.
Thank you so much, Lisa. And our next speaker is Ari Arnone. Ari, you're a CNA as well in Madison, and another member of SEIU Wisconsin. You've worked at your facility for 7 years, and I know you're a leader. You've been on the bargaining team. You helped win the last contract for your facility. And there's a theme here. Family and relationship building is also extremely important to you. And it's your mother that inspired you to do this work. You want to tell us about it?
Yes. So first of all, thank you, Vice President, for having us here today and being able to speak. And thank you for everyone else who was involved for putting this on. It's a very nice thing to be able to speak to someone who cares about it as passionately as we do. And having it at your level is very thankful. I'm thankful for it. So, based off of family, I think that's yours. Yes, my mom got me started. She actually worked at the facility that I currently work at for 17 years. And I didn't want to be a CNA at first, but she made me. She made me take the CNA class in high school, and she said, just in case. And I don't want to say she was right, but here I am. Being a caregiver is very rewarding. As Lisa and you and Vice President Harris and April has hit on, they become a person or a member of your family. And going to work every day, you get to be with them one-on-one. You're there through their happy times, their bad times. When no one comes to visit them on holidays or birthdays, you are the one that are there to be able to share those moments with them. And being short-staffed makes it very difficult to be able to get that personal level and interaction with them. You don't want to treat them like a job because they're not. They're a person. Mm-hmm. And I think that's what everybody needs to understand is they are not just a job. These are people that we are taking care of. Mm-hmm. Just like us, they have health needs. Working short-staffed, it takes a toll on us as well as residents. We have to worry about our health, and in return, it makes it difficult to worry about their health. And being short-staffed is just something that in this line of work can no longer happen. And I want to thank you for being the one to power forward with the fight and advocating for us. And I can't wait to see these great changes. Mm-hmm.
So one more Lisa. Lisa Gordon is also a CNA and a med tech in Monroe. I know, Lisa, you lead big time in your union in a very powerful way. Lisa Gordon is the vice president of SEIU Wisconsin. You speak out all the time for nurses in the Capitol during Nurses Week, as well as to the Finance Committee. So thank you so much for your leadership. So can you share with us your story today?
Thank you for having us here, Vice President Harris. like Ari said, we are grateful that you and President Biden is looking at this and finally getting something done. So, like, my name is Lisa Gordon. I'm sorry. I am a proud leader of SEIU Wisconsin. I've been doing this job for 29 years. I entered this field because I care about taking care of our elderly, and we need to do better by them. And being short-staffed is not taking care of them like they should be. They didn't wish to go to a nursing home or to have somebody else come into their home and take care of them. This is something that happened to them because of health. These are our family members, our second family. I care about my residents, and when I'm not at work, I worry about them just like if I was at work. They didn't ask to be there. I try to take care of my residents just like if I want to be taken care of when I get to that point. Just think about it. This could be you. It could be your grandmother. It could be your mother. Say short staffing, if a resident's got to go to the bathroom, they've got to wait. If we've got to feed somebody, the next person's got to wait to be fed. You know, we need to do something. These might seem like simple things to us, but they're not to them. You know, so I am so glad that something is finally getting done, because with a federal mandate staffing, it'll make these big corporations say, hey, we got to do something, because they shouldn't be profiting off of our elders' dignity. And that's what they're doing. As a worksite leader for my union, I am proud to fight to improve our industry. With better staffing standards, we will be able to do that. And our elderly will be taken care of better than what they are at this point. I try my best, and every CNA here, I know they go into this with all heart. You know, and there are days that you want to walk out crying and throw your hands up, but you don't, because your residents are your family. They're your loved ones. When you walk into the door and a resident comes up and gives you a hug and says, thank you so much for being here, I'm glad you're here, that makes your day. And that's what this job is about. And we need these changes. So thank you so much.
Thanks. Lisa, we want to give the Administrator Brooks LaSure and the Vice President an opportunity to respond, but then please.
Well, just to say, I just want to say how much all of the stories that we have heard from, how much you care so deeply about people has really impacted all of the analysis that went into this rule. And maybe just to ask, when you're hearing these changes, what does it mean to you in terms of the changes that you hope happen at, within your nursing home?
Well, for me, I feel like when the change come, that it'll make the residents more happy. They'll feel more safer. We'll have less fall risk. They can get more care, and they can get some companions too while we taking care of them. Because some residents like you to sit in there, talk to them, you know, be with them and stuff like that. So it'll be great to have that change come. And I have wanted to say one more thing. Like, now in nursing facilities, it's just not old people in there no more. It's a lot of young people coming in there.
Yeah.
So they be in their right mind. So they really actually see if you short or do you have real staff here. So that's one of the things I have wanted to say. And that's it. Yeah.
I also just think it's important to note, if I may, that most of the people that do work in the care infrastructure It's women.
Yeah.
It is women of color. It is immigrant women. And so when we center the work in these communities, when we center women's work, we are changing the lives for their families. You know, the rule around pay is huge. We have an opportunity to transform work that used to be done by enslaved women to family-sustaining work. And that will have deep ramifications for our society that go beyond our wildest imagining. So I just needed to lift that point up because we are undoing
Right.
some things that have needed to be undone for generations. So thank you.
Exactly. Yes,
Amen.
Thank you.
Yeah.
And if you don't mind, I'll just put a fine point on that. You know, there are people in our country right now that are suggesting that to focus on diversity, equity, and inclusion is a bad thing. Because they may not want conversations like this to occur, which include the issue of pay equity based on gender. Whether it be in the WNBA, wasn't March Madness fantastic? Oh my God! Whether it be in the WNBA, or recognizing that the traditional work of women, nurses, teachers, remains underpaid, especially when you measure it based on the value of the work. The value of the work is profound in terms of what that does to lift people up. I think there's a certain, I don't know, perverse thing that's been happening in our country. I'm just going off script, obviously. There's, you know, kind of a perverse thing that's been happening in our country over the last several years, which would suggest that the measure of your strength is based on who you beat down. Instead of understanding the true measure of strength is based on who you lift up. And that the sign of real leadership, one of the character traits of real leaders is to have some level of compassion and concern about the suffering of other people, and then want to do something about that to improve their condition. That's the work of these workers that we're talking about right now. And we as a society should value that. And I just can't thank you all enough because, you know, I took care of my mother when she was sick and she had cancer. And I did just a fraction of what you do and for a fraction of the time that you have done it. And there's no way that somebody can do this work without it involving their whole being. You know, this is not, I loved what you said, that this is not, you don't treat them as a job, they're a person. It's not a job. And it is, yes, about dignity, and it is a lifelong commitment. And so I'm just very honored and grateful to be a part of what we are doing, Madam Administrator. But again, we still have a lot more work to do. But this is an important day of recognition of the work that people here have been doing for decades and decades and generations.
I'll leave it
Don't
right
let
there.
her keep going.
Thank everybody for being here today. Thank you.